Hi, my name's Chris Maunt. I wanted to talk to you today about low back pain. Maybe you have low back pain, or maybe you're a healthcare professional who works with patients or clients who have low back pain. 2 points I wanted to make today. First of all, did you know that most low back pain is idiopathic? In other words, a definitive cause never is identified. There isn't a definitive reason for the symptoms. Did you also know that clinical imaging studies like MRI, CT scan, X-ray can be notoriously misleading and unhelpful in trying to figure out how to help somebody who has low back pain? Why do I say that? Well, very simple. These studies are notorious for identifying things that may, in fact, have nothing to do with your symptoms. A good example is someone who has an MRI that clearly shows a disc injury at L5-S1, maybe a herniation of 5, 6, 7, 8 millimeters, and yet this person finds that sitting down is very comfortable. Anyone that has worked with many disc patients will tell you that if they tell you that sitting is a comfortable position, you can pretty much rule out disc herniation as the cause of their symptoms. That's just, those two things just don't fit. And yet in that instance, that unfortunate individual might end up having a procedure to remove part or all of the lumbar disc. And of course, after the procedure, they're going to be no better off because that wasn't what was causing the symptoms to start with. So you have to be very careful with just how invested you become in the results of clinical imaging studies. They're just one part of the evaluation process. You also need to look at the history, what causes the pain to increase, what mitigates the pain or reduces the pain. And you also need to be able to do mechanical testing or provocation testing to figure out what is actually causing the symptoms. It doesn't matter what's on a picture, like an MRI or a CT scan or an X-ray. All you care about as the patient or the therapist trying to get results with their clients or patients is what's actually causing the symptoms. So if this interests you, then fill out the box to your right, click on Submit, and that will instantly kick you into another screen where I give you a longer piece of video and I explain how to do these mechanical and provocation tests so you can start to distinguish between sacroiliac joint pain, disc pain, spondylolisthesis pain, and therefore not be so confused by the dogma that goes with CT scans, MRIs and X-rays.